So if, for example, a person is associated or habitually taking a cigarette whenever he takes coffee, so the sight of the coffee mug even can trigger cravings in him without even having a stressful environment.
So I need more of that substance. I need more of that probably digital world that I'm engaging in to feel happy or gratified about what I'm consuming.
So every chore or duty or responsibility is tied around the substance. So substance comes first.
So they may also have disturbances in their social environment.
With the personal life, the professional life also gets impaired.
I'm stressed, so I need to smoke. I'm stressed, I've had a bad day, so I need to drink. Welcome to another series on Dialogues with Inspiring Minds with our very own special guest, Dr. Sudarshan here, a very eminent psychiatrist who's been treating clients with various conditions and disorders. And he's here to have a quick talk with us to educate us about what are addictions, what are we all having as micro habits that aren't really helping us, and how does it affect our brain, our blood routine, and our physiology. So, welcome to this podcast here today. Thank you so much for being here. And it's lovely, would love to explore this conversation with you, hoping that we're all going to learn through this conversation and bring about any sort of change that we can in our lifestyle and our thoughts, and anything that we can do to enhance who we are as people. So, thank you so much for joining us.
Thank you for inviting me. It's my pleasure to join.
If you could tell us a little bit more about where and how you went into psychiatry, and to how come you picked this field though first?
Okay. So, psychiatry was not an option very clear till my UG MBBS years. So, during my MBBS, second and third year, I had a person very close to me and who was undergoing something I couldn't understand at that time. So, I couldn't understand, even the family members were not able to understand, and he was not having proper help. And with the knowledge I had at that time, I tried helping him out, taking to specialist doctors, but again the illness could not be treated as it has to be treated, and he didn't have a very good prognosis as such. Then I thought that the magnitude of importance given to psychiatry as a field is very less, and even in societies that are well educated, there is a lot of stigma in bringing the patients to the doctor's care. And I thought there is a dire need for a doctor at present in our society to be in psychiatry to help people. So from there I started learning about psychiatry as my uh, special interest in MBBS, and then in my exams, I opted for psychiatry as the only option. So that's how I ended up in psychiatry.
You also have an education qualification from a very eminent institute. Would you like to tell us a little bit more about your experience while you've been there?
Yeah, definitely. I'm from KMC Manipal. So it has been, as you told, a very enriching and enlightening experience. So what I had in mind about psychiatry was very totally different, which is based on the information we gather about psychiatry from other people and colleagues. But when I went to Manipal, the experience was totally new. It was very organized to the point, and they taught us how to approach a patient with empathy and also with accurate medical care, which I think both are very important, because empathy plays an important role in this specialty, at least, which I learned in Manipal.
I often think that us as practitioners, when we choose this field, we usually come from a space of empathy because we see ourselves experiencing something or someone very near dear to us, right? Otherwise, it comes from a place of sympathy when it comes to mental health, right? And the fact that you had this personal experience where you saw somebody very close to you going through something like this would have been a very awakening space for you, that the healthcare fields need something like mental health, right? Was it a tough choice for you to make to get into psychiatry, because there is still a lot of space where people may not look at the field for its importance? Have you found that difficult while you're practicing?
See, I've never regretted even a single moment after taking psychiatry, but I had my doubts before choosing psychiatry whether I will be a candidate eligible to pursue. But I think with adequate training, I don't think it was difficult for me to uh, take psychiatry as a specialty, because what I shared about the person was a simple illness, mental illness, we call it OCD. It could have been very well treated with the available medications we have. And only thing he couldn't get at that point of time is a doctor who can give the care and a situation that could take him there. So yes, difficulties are there in every field, I guess. But psychiatry, I don't think it is something very difficult or anything to pursue. Just you, as you told, a bit of empathy to know how you will feel when you are in their shoes will give a perspective of how you will treat as your family member. I don't think it is a difficult branch of field.
While you say that, I also know that there is something called as compassionate fatigue. As an expert in the field, where you're constantly listening to everybody else's challenges, because nobody is going to come to us with very happy news most of the time, right? They're talking about their challenges, negative experiences. How do you, heal? How do you set these boundaries from your work?
See, it was difficult initially. 1 or 2 years, we used to still think about a patient we could have helped beyond what we did. But I think now it has become a routine. So it's like the white coat we wear, we go in front of the patients. At that time, we try all our resources to help them out. And I think when we come out of the clinic, we have to take that coat off, and we should stop thinking about what we could have done better. I usually think like I will be present at the moment at least to help them, and I have created that boundaries helping me to keep me also not getting very stressed, as you told, burned out by the people, problems people bring. But it is not that difficult. You can just split after your OPD or after your clinic, and it comes with practice, I think.
Now, I'm sure you've dealt with diverse clients, right? We want to specifically focus on addiction today. What causes addiction? Can you tell us what is addiction first? And then we'll get into the causes of it.
Okay. So, addiction is a condition that is characterized by a repetitive or a compulsive use of a substance, or it can be engaging in a behavior compulsively despite knowing it is harmful.
What is compulsive?
Compulsive, yes, we know that this is harmful, this should be avoided, and it is not just the failure of willpower here. So a person knows that it is he doesn't require it, but he still indulges in that activity or indulges taking that substance, because addiction over time causes complex changes in the brain, so that it becomes difficult for the person to stop at willpower only. So it becomes compulsive in nature or repetitive in nature.
So there is something that I'm consuming or engaging in an activity which I do repeatedly over a period of time, and it has now become harmful in terms of my usage, but I'm still not able to draw the boundary or let it go.
Yes.
So that is addiction.
Yes.
So it also means that it's going to impair both our social and our occupational functioning.
Yes, definitely.
So when does somebody know that they are addicted? Because maybe we're in social occasions where we are engaging with this, or probably we're dependent on it. But when do we determine that it's addiction, and how do we determine that?
Yeah. So initially, when a person starts using a substance, for example, if you take cigarettes or nicotine, or indulging in social media also, it starts as a, you say, by various factors: peer pressure, tendency to explore, experiment. But what exactly happens with that is a part of the brain known as the reward system gets hijacked by that substance. So it starts producing dopamine whenever the substance comes in. So beyond that, over time, so brain starts associating this behavior with something for stress reduction, something for social bonding. So this starts growing. So a person lights up a cigarette whenever he feels stressful, and then a person takes a mobile whenever he feels bored, or he is doing a mundane task, he is compulsively taking his phone to check what is happening. So once this process sets in, our brain starts managing its dopamine supply. So the natural dopamine supply comes down. So our brain is totally dependent on these activities or nicotine for its dopamine supply. So the person may require a higher amount of dopamine. So he will be going to more number of cigarettes. So the screen time, for example, may increase from half an hour to 2 hours. So this is where we say that the person has undergoing tolerance to whatever he is taking. That is the point where we say he's getting addicted to that substance. When higher amount of substance is required to attain the same happiness he used to get previously with a lower amount of substance. Also, a lot of external factors play an important role in this. So if, for example, a person is associated or habitually taking a cigarette whenever he takes coffee, so the sight of the coffee mug even can trigger cravings in him without even having a stressful environment. So external triggers also play a factor. So our understanding now has broadened from thinking this as a moral failing of that certain individual to being addiction as a condition which is biologically rooted, and it requires proper treatment and strategies to come out of it.
I think you beautifully put that across, where there is a reward mechanism for a stimulant that I want, and I associate it with my environment or because of my internal factors, and I continue to repeat the behavior, and therefore it increases my tolerance.
Yes.
So I need more of that substance, I need more of that probably digital world that I'm engaging in to feel happy or gratified about what I'm consuming.
Yes.
What are the signs and symptoms that say now this person is addicted to smoking or they're addicted to the digital world? What are those signs?
As I say, when we can say the person is addicted, so there is a rewiring that happens. So it is not with the first cigarette, it's not with the first time you check on a social media. So a rewiring happens in the brain over a period of time. So rewiring as such, certain areas in the brain starts to weaken its functioning that's concerned with decision making, self control, judgments. For example, this area is called a prefrontal cortex. So this becomes weaker with the substance more and more being into the action in the brain. So certain areas in the brain which are concerned with anxiety or craving, which we call it amygdala, starts to overfunction. So there sets up an imbalance in the brain. So when this imbalance sets in, there becomes a very, very, very difficult urge or craving for the patient. Whenever he tries to genuinely quit also, it becomes difficult for him. So that's when we say that the patient is undergoing something very difficult, when the process is very difficult. He's trying genuinely to quit, but this complex imbalances that has like set in over the period of years is not allowing him to quit at willpower. We say he may be addicted to the substance and he requires treatment options or strategies that can help him out.
So we are saying that when the decision making power comes down, the problem solving ability or the judgment comes down, and our amygdala, which is responsible for our emotional centers in the brain, and the anxiety increases, of course, I don't have the willpower to make the right judgments in my life. And that's where the loop continues to occur, where the emotional states are high and my judgment is low, and therefore I go into a process of addiction as well.
Yes, exactly. It is not only the decision making capacity or self control, I would say. Other domains of functioning also worsens over a period of time. As you told, the dopamine supply to the brain is mostly dependent on the substance he is seeking or the digital media he is seeking. He gives utmost priority to it. So you can see the person giving very least importance to his responsibilities, duties, roles, work, academic career, whatever it is, and substance taking the utmost priority in his life. And that also is a very bad sign we see in the course of addiction, which we say that needs treatment at that point.
So I would rather, instead of finishing my meeting, I have the need to go and take a smoke and come back.
Definitely.
Right? So I replace the priority.
Yes.
It's my smoke time, I will go. It's my time that I want to consume alcohol, I will go. So I will prioritize it over the responsibilities and the daily chores that I have. And that's when we also classify that to be addiction.
Yes. So every chore or duty or responsibility is tied around the substance. So substance comes first. So after substance comes all the things he wants to do, which was not the case maybe 5 years back or 10 years back. So substance becomes like when there is a family occasion or a temple gathering, the person will be more anxious to how to procure the substance rather than how do I attend the function. So these are mild things you can pick up in history where they say they are giving priority to the substance more than their duties and responsibilities.
So they may also have disturbances in their social environment, right?
Yes.
So if they have a partner or a family and the partner is requesting them to not go and take the substance or to spend time with the family, it's causing a lot of conflict. So even when they know it's causing a lot of conflict and they know it's time for them to quit and they are unable to, that's also a different sign for us.
Yes. So when the pattern has become very habitual or addictive, more dependence has also been set in. So usually we will see eroding of trust and communication happens in the person. So this eventually leads to broken relationships, constant conflicts with the partner, constant conflicts with other family members who try to discipline them. So all this sets in their personal life also. Also, we may see a lot of financial instability setting in and the person trying to compensate it. So when we take an example of nicotine, so it will be a lot of money being spent on it and a lot of lack of productivity, academic failure, but the person fails to attribute or refuses to attribute to the substance. That may also be a sign.
So there would be some sort of a cognitive distortion where they start rationalizing, justifying these behaviors as well.
Yes, that can also happen. So with the personal life, the professional life also gets impaired. So a behavior sets in that, okay, with this I will try to compensate, with this I will try to compensate, and that becomes a vicious cycle and they end up being less productive and more conflicts end up in the family.
Example, there is a conflict or a situation that they need to solve. So they justify it saying that I'm stressed, so I need to smoke. I'm stressed, I've had a bad day, so I need a drink. Right? So they justify it with their day to day living.
Yes.
With their family.
Yes. So when the habit becomes a repetitive behavior in their life, it takes very less conscious effort for them. It becomes a automated engine that works. You don't need to control it before the stress comes in. So even I was giving an example, no? Even seeing the site of previous stressful experience, there may not be a conflict in their work, but if they suspect there may be a conflict, there will be a smoking behavior to alleviate that stress.
So they go back to the previous patterns that was once comfortable because of the neuronal connectivity as well. It's an automatic behavior that comes to them.
Yes, it becomes automated. So see, when we try explaining habits, so we try to understand it by a cycle. So a habit has a cue, a habit then has a reward, and between that there is a routine. So the cue is the stress we are seeing or the boredom we are seeing in work, and their routine will be to smoke, have a cigarette in between, and their reward will be to feel relaxed. So when this loop becomes automated by a lot of repetition, so repetition means whenever a neuronal pathway is repeated again and again and again, it becomes very stronger. It's like carving a path out of a forest. So you go many times, it becomes deeper and clearer so that you can see the route. So the brain also follows the neuronal pathway, which is repeated, becomes very stronger. So this gets repeated because of its reinforcements that are there. So reinforcement as it what we get from that behavior. So smoking has positive reinforcements. That is the immediate gratification or immediate satisfaction they have of a sense of relaxation. And then comes the negative reinforcement. Like if I don't smoke, I will become anxious. I will become angry. So that comes as a precautionary thing. So they try smoking again. And then this becomes sensitized in the brain. So beyond a point, you don't need the harmful effects or you don't need other things to come in their brain. So whenever the priority is only given to substance, so they will be going for the substance without. That's why we see people, even they are aware of the negative consequences of any substance or digital media, but they still can't stop it because the brain is overvaluing the behaviors that gives more dopamine rather than thinking about the negative consequences. That's the automation that happens.
So, are there any changes that we see in our blood work when we have any form of addiction?
Yes, definitely. Addiction is mostly seen by people as a disorder of brain or the mind. But addiction also disrupts the harmony and the physiology of our body, which we can find out by our routine test also. So, for example, if you take nicotine, so nicotine or smoking, so it disrupts our body stress response mechanism. So it overactivates our stress response mechanism. So it increases a hormone called as cortisol. So it is secreted only during time of stress, but cigarette increases it because it overactivates it. This cortisol can increase a person's heart rate, blood pressure. On the longer run, it can worsen their immunity also. So any recovery from infection, any recovery from any disease will be slow in patients who have a regular use of nicotine. Not only that, nicotine also elevates inflammatory process in our body. So that can be found out by certain markers we call inflammatory markers. One is C-reactive protein, one other cytokines can be found. These things are pointers towards future cardiac risk or metabolic illness they could develop. And one important thing nicotine does, or other substances like alcohol also contributes, is disrupting our body's sugar control mechanism. That is a very devastating process because it alters insulin sensitivity. So sensitivity is how our cells respond to insulin. So it alters it. So there is a hike in blood sugar. So this over a point of time is seen as increase in blood sugar, but over the course of years, it can end up in diabetes and other metabolic disorders. And other thing which are commonly known to people, but they mostly ignore are increase in cholesterol profiles. High cholesterol levels are directly related to increased smoking, which can point towards cardiac illness. But when we come to digital media, there are no physical signs that are directly can be seen. But again, it is very complex and it can also lead to all these processes. For example, increased social media always promotes an increased sedentary lifestyle. So sedentary lifestyle will cause problems with your weight, and people can um, have problems with hormonal secretions also. A disturbance in hormonal secretion and obesity can result out of it. And it disrupts your normal biological rhythm. Most of the device and digital media disrupts their circadian rhythm, which can lead to sleep disturbance, insomnia in future. So what was seen just as a weakness of mind also has a lot of disturbances in the body that we should be mindful of. And even routine physical examinations and blood test can find these things out, which can be a pointer to start the talk with the patient if they are not willing to stop the substance.
We also know that we have something called as pre-morbid conditions of personality. What are those factors that lead or indicate that somebody would or likely have an addiction?
Yeah. So yes, everybody who starts smoking a cigarette doesn't end up being addicted to it. There are a lot of factors. So I would say the main contribution is by genetic and biological factors, and psychological factors will be there, and environmental factors, and comes the personality factors. So some personality traits we could see in patients can be predisposing to a higher risk of being addicted to substances. So, for example, a patient having high impulsivity, that can also be a genetically acquired trait. High impulsivity will make the person to individual to explore and experience more and more substances, which may be having a high risk of he or she being getting addicted to that substance. And other thing is high neuroticism, or we can call it negative emotions, high anxiety traits. This can also make the person go to substances to smooth or to make them at ease, to comfort them. And other thing we see is low self-esteem, or poor social skills, social ability. So a person may use substances to fill the emotional void of socializing, or to build a temporary confidence in them. So also low self-control traits can also lead to this. But as difficulty controlling their urges can be seen in individuals with low self-control traits.
They could also be very high risk taking.
Yeah. Uh, there are some traits we see, like difficulty with emotional regulation, where we see impulsivity also there, and high risk behaviors, and where when they have a problem with handling their emotions or managing their emotions, their go will be to substances to cope them, and high risk behaviors also. So it doesn't mean that a person has a personality trait. It is a guarantee for him to develop substance use. We see many individuals with the traits I mentioned without substance addiction or even substance use. So in those cases, there will be awareness of their vulnerabilities or good coping skills they have developed over the period or good support system they have. But it points us to early detection in patients and tailoring treatment. And it doesn't just guarantee that this personality trait, substance use 100% will be there.
What about the genetic factors that you mentioned?
Yes. So genetic factors may be a big contributor. 40 to 50% of substance risk can be attributed to genetics. For example, a person has a trait of high sensitivity to dopamine, can end up being high risk of developing substance. Again, high impulsivity because of structural and functional changes also, which is also a biological factor in areas which we spoke about. The reward prefrontal cortex can make a person highly impulsive or reward seeking in nature. So these are the factors which can make a person more prone to develop substance abuse. For example, family history of substance abuse or substance addiction in the family can pose a threat to him to develop in the future.
So, anybody in the three generations within the family have any history of addictions or mood disorders or any psychiatric illnesses can lead to posing as a threat for somebody to
Definitely.
develop an
So
addiction.
when we talk about other psychiatric illness, when we talk about depression and anxiety disorders and attention deficit hyperactivity disorder, there is a high co-occurrence of substance use in these patients. So usually these disorders in the family also increase the risk of the disorders coming in their future generations. And with these disorders, there is also a high chance of substance use because people usually use it to self-medicate themselves out of the symptoms. So that psychiatric disorders comorbidly present also poses a risk for development of substance use.
And what about the environment factors or psychological factors that is contributing to somebody picking up an addiction?
A stressful upbringing or a lot of stressful events from their childhood, a person may be forced to go to substance to cope. It would have developed as a coping mechanism whenever stress happens. And also, easy availability of substances may be a risk factor in an individual who is exposed to substance to not exposed to substance. So easy availability and age at which the substance use starts. So the earlier the age, the higher the risk a person can get addicted to the substance because the brain is still growing, malleable. And in that time, when a person starts early, there is a high chance of him developing substance addiction in the future.
Do we see that gender or sex has to play a role in addictions? Have you in your experience?
So usually it is not a very strong factor to say that this gender or this sex has a high prevalence of substance, but it comes to developing. When you take alcohol, there is a problem of who develops because of their biological factors damage more than there is a variation in gender in alcohol. But nicotine, the incidence may be high, as I told, because of the availability of substance, easily going out and getting substances, and early age of onset. We see a gender, male gender, having more use or prevalence, but that doesn't alter the outcomes they see when they get addicted.
Can you take us through your experience of any client you have seen? What has their journey been like? What has been their recovery, if there has been? What have been the treatment options that you have recommended? Can you take us through somebody's journey, please?
Yeah. So I had a patient who was working in an IT sector, and he has come for consultation. But there was previous attempts of quitting tobacco, cigarettes. Previously, he has tried a lot of times and he was not able to do it. So he thought he could do it by his own, but he had symptoms like fogging of brain in work, sleep disturbances. So he usually goes back to the substance. So he has been smoking since his college time, and it's been like 20 years he has been smoking, and in dependence or addictive pattern for the last 15 years. So the number of cigarettes he was smoking was very high, and there are also health parameters which have gone to an alarming limit. But those are the factors which he knew, but he couldn't come to treatment to stop cigarettes. So there was one day he was just in his meeting in his laptop, he saw his 6-year-old son getting scolded by the mother. Then he went out of the room and he kept a pen in his mouth and he started mimicking the smoking gesture of the father. So that hit him very hard, that these factors he is contributing to smoke, like work pressure, stress, is also getting modeled into his next generation. Then he thought, okay, I may need help now. So then he came. So when a person immediately stops cigarette, and you say in the first hour, so the brain starts losing the dopamine level. It craves for the dopamine. So they get uncomfortability, irritability, anger as the withdrawal symptoms. But when it goes to one day, so one day it will be more like the imbalance of neurotransmitters in the brain, especially dopamine, causes an emotional instability. Mood swings may be there, anxiety attacks may be there. And when the person goes to second to third day, that's where the peak craving starts. And the peak craving also causes problems with your cognition, cognitive impairment, not able to concentrate in work, fogginess, and sleep disturbances. This is when usually, and also my client, went back to cigarettes. So the third day, usually it is always 2 to 3 days, he will go back to cigarettes. So this is where we treat them with certain agents we call as replacement therapy, nicotine replacement therapy. It's given as a form of gum, patch, or lozenges, whatever form, usually equated to the amount of cigarettes they are smoking. It's given to come out of this discomfort or being at ease. So this will reduce the mood swings, anxiety symptoms, because nicotine as a chemical being given in a medically formulated form to the patient. So he won't have these symptoms, so he won't go back to cigarettes as such. But after 3 days, the first week, there will be improvement in the neurochemical levels. So the emotional stability will be achieved. A person can manage. And in the first month, so the cognitive symptoms go off, cognitive clarity also comes. But again, here also, patient will have craving. So whenever the cue comes, whenever they go to the shop where they used to smoke, whenever they see friends they started smoking with, these are the cues that they can't say no to. And that's where we also have prescription medications which we can prescribe, which will reduce their cravings. Not only replacing nicotine, this will reduce their cravings. And there are also medications which will not give the effect which nicotine used to give when they smoke also. It will reduce the effects of nicotine in their body and it will reduce its craving. So after this period or even during this period, it is not one method of treatment that works for everyone. It is always multimodal when it comes to substance de-addiction. We also use behavioral interventions and psychological techniques, which are also very helpful in the patients coming out of it. Especially in nicotine de-addiction, psychological therapy form known as CBT, cognitive behavioral therapy, helps them explore their triggers, go for a healthy coping mechanism, which will be taught by a therapist. And also motivational enhancement therapy, where a patient is made to reflect why he stopped smoking, and through process of interviews where we can enhance his motivation. With this, medication support, and third comes a support group. It can be a friends group or a therapy group or a counseling group, which increases his accountability and encouragement to go through the process. So it is always not one method that works for everyone, and it is always tailor-made based on the patient's preferences and the level of addiction they have.
I think you beautifully explained once again about the process of what happens in the brain. It also, you explained the treatment options that are available. So, when it comes to psychiatric treatment in terms of medication, are there also medications that help alleviate your symptoms, your signs, and your withdrawals?
Yes. So mostly in tobacco or nicotine use, the alleviation of withdrawal symptoms is done by nicotine replacement therapy, as I mentioned. To reduce cravings, there are medications like bupropion, parentlin, which have been tried and which have been effective in reducing the cravings also. And other things like sleep disturbance, anxiety may require symptomatic treatment for a short term with the medications for that. That may not be required for everyone, whatever symptoms they are having. If a person has sleep disturbances, even after quitting, a mild anti-anxiety medication can be prescribed for him to help with sleep. So it is again tailor-made based on patient's symptoms and presentation.
So when someone comes to us, we initially do a case history taking, a screening immediately. We look at the severity and the chronic side of the illness, and then recommend both psychotherapy and counseling, as well as the consultation with the psychiatrist in order to manage their physiological symptoms of craving or probably their withdrawal symptoms as well. And how long does this process take?
Again, it is not a set period, as I told. Many people come to a clarity within 2 to 3 months of being abstinence. So usually till that period, medication may be required. Nicotine replacement therapy regimens usually plan for about 12 weeks. And then we try to take them off nicotine replacement. And some people may require medications to reduce their craving for an extended period of time also. It is again based on the patient's presentation. So usually 2 to 3 months, and by 6 months, most people recover if they are consistent with their medications and treatment methodologies.
Very often, people with smoking addiction do not think it's a problem because of its easy access and acceptance somewhere in the society and culture. Right? We generally look at alcohol consumption as an addiction. That's when people come for immediacy and urgent help. However, why and how does somebody not get treated? What happens to them? What happens when you don't treat smoking addiction?
Okay. So, smoking introduces a chemical called nicotine in our brains. So, this goes to a receptor, an acetylcholine receptor, and which makes dopamine to come out. So, this what makes them addicted to the process. But when the person continues smoking, so there happens damage to the gray matter of their brain, which we call a prefrontal cortex and other areas which are responsible for decision making, identity, judgments, and also memory, attention, and all these functions. So when there is a chronic pattern of this going on, there is a high chance of cognitive impairment setting in the brain. So they may have memory disturbances, and there is a very high risk of neurodegenerative illnesses like Alzheimer's to set in very early. So that's why we say a puff or a smoke can be temporarily gratifying because of the relaxation it causes, but it takes away the cognitive clarity on the longer run and our brain's health. So that's why it's a priority for brain's health to reduce and stop nicotine usage.
What happens if we don't learn to manage our screen time?
Okay. So as I told, screen time again will cause problems in a person's circadian rhythm and biological functions. So they can end up having disorders like obesity, insomnia, and changes in their hormonal levels. So these can lead to again a future risk of cardiac illness, metabolic illness, and screening and reduction and treatment of this can be done with behavioral interventions. Medications are not required in most of the patients. We can just treat with behavioral interventions and psychological help. And I think this can prevent. So earlier the treatment starts, you can bring back into control the long-term side effects that could have been avoided by this.
We've often heard the 21-day transformation challenge, something that we also practice at Inspiron, where it's a habit change and a transformation program. How do you think somebody would benefit from a program like that?
Yeah. The 21-day program is successful because it gives a structure and it gives a time frame, achievable time frame for an individual to work on his behavior, to focus on your behavior change. So What again happens here is the neuronal pathway gets stronger because of repetitive actions what he is going to do on the 21 days. So this time is not very it is long enough to cause consistency in a patient, and it is also short enough to cause the motivation to be going. So the 21 is not a magic number.